I have a family history of pancreatic cancer. Those who have succumbed to the disease were both heavy drinkers and smokers. I am neither, but I am concerned. Is there a test or procedure to check my pancreas just to be safe? Okay, very good question. This might be the question of the day, Ernest. You're going to get the award for the question of the day. Pancreatic cancer, again, runs in families. I have patients now that are, their grandfather passed from it, their father passed from it, and now they are suffering from stage 4 at a very young age in comparison. So very important that one of the things you can do is optimize your immune system function, taking probiotics and vitamin D. The normal level of vitamin D is 30 to 90. It's measured in 30 to 90. If your vitamin D level is 60 or higher, it's found to be protective against a variety of cancers, including colon cancer, prostate cancer in men, breast cancer in women, and pancreatic cancer. The first thing that happens when a person is diagnosed with virtually any type of cancer is that they place them on high doses of vitamin D. It works much better to prevent than it does to treat and or cure. So I would be on a vitamin D regimen immediately. I would also monitor my pancreatic enzymes. You can have that done by your primary care doctor, the internist, or family physician. They can draw blood work on you that can help monitor those things. And that way, if there's no direct pancreatic cancer test, matter of fact, there's not a direct test for the vast majority of cancers that will answer that question other than a biopsy. It's not cancer until the pathologist says that it's cancer. And that means getting a biopsy. Nobody's going to biopsy routinely. So there are routine tests that can make you look further. You get sort of a test and your pancreatic enzyme levels are elevated, or your bilirubin goes up because there's some obstruction to your gallbladder flow. Those sorts of things. You start having digestive changes. If you have a change in your bowel function, where your stools change color, or they become oily, or something different. That's the most important thing. Change in what is normal for you. You're not having bowel movements as frequently, or you having more frequent bowel movements. Whereas you normally would go once a day, now you're going 3 or 4 times a day. Or you normally would go once a day, and now you're going once a week. These are things that will open the door to looking further and then finding. Then you can get everything from a CT scan to an MRI. Those do not answer the question, however. They can still let you know whether you need to look further for some potential other problem. So so you need to be good friends and partners with your healthcare provider to make sure that you stay on top of this and monitor this. Because the problem with pancreatic cancer is most of the time, by the time it's diagnosed, it's already in its latter stages. And very few people survive more than 6 months with pancreatic cancer. Most people are going after the 6 months after the diagnosis has been made. There are prolonged cases. Alex Trebek from Jeopardy, he lived almost 2 years from it. But Alex Trebek was a multimillionaire with a whole lot of money to spend treating his disease state. But still, the pancreatic cancer ultimately did consume him. He just had an extended life compared to, regular people, if you will. And I like to talk about the things that I talk about in healthcare as far as regular people are concerned. And that's you and me and everybody else is in the world that may not necessarily have access to a lot of extraordinary means. What are the things that I know that I can get, the things that I do recommend for you, and things, but, under other circumstances, I may tell you there's an extraordinary treatment that's available in Canada or in Germany or something like that. You might need to go evaluate that to do that. But for my recommendation, Ernest, partner with your primary care doctor, start monitoring these things, let them know your family history so they'll stay on top of it. There are genetic tests for cancer now that only will determine your genetic predisposition. A positive genetic screening test for cancer does not mean you have cancer. It just means that you're more likely to get it than someone who doesn't have the appropriate gene structure. But I know that because of your family history. You say you have multiple family members that have succumbed from the disease. That being the case, I already know that you have a genetic predisposition. And so I don't necessarily have to do that test on you. Not a bad test to get, but still, there are other tests that are much more apropos for this disease state. So glad you don't smoke. Drinking in moderation is probably okay. You don't have to be a total teetotaler, but you said heavy drinkers, and we're not talking about heavy drinking. We're just talking about drinking in moderation on occasion, and you probably be okay to do